Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning.
Say good morning.
We were talking about the sunrise. Absolutely.
Oh, what a beautiful sunrise. Hallelujah. Welcome to Florida.
Oh,
the
that's
Sunshine State.
No, you're right, because people up north, we were just up north in Baltimore, and you don't wake up to this. And I think that's why people must be living longer down here.
Right. We have more fresh air. We have more green.
And more light. You see, the light is what makes people
less
feel
chance
better.
of depression.
Yeah, exactly. You've talked about that. But I think our topic today,
exercise.
Exercise, because people get up.
Exercise. But when you go, Richard.
Well, he's swimming now. He's doing a lot of things. He said that.
He's in good shape. His cardiologist gave him a thumbs up.
Oh, good.
Dermatologist gave him a thumbs up.
Good.
That's my man right there.
That's our man.
It's going to be the poster boy.
Oh, okay. It's going to be our poster boy. Okay, so I said to Dr.
For
Mencia,
the people listening, Richard is our master controller.
Yes. And a lot of things. He's the one who found my car. He's the one that helps me with a lot of things. He's the one that came up with the idea.
I brought all your bags.
Yeah.
Give me some credit.
Thank you.
Give me some credit. I brought the bag in. Even your purse. I brought your purse.
Oh, my gosh. You're you're going to charge me for that now?
No. Ina say I look good with the purse and everything.
Yeah, small purse. Those small
Ina
purses.
say I look like a bag lady.
A bag lady. This is so bad. Okay, so let me get a little serious here about something. I told Dr. Mencia this morning that I was going to join a Pilates class. And he looked at me and he said, "Are you exercising?" I said, "No, I'm going to do that." And then everything blew up. Tell everybody what you said.
Well, a lot of people get hurt at doing exercises. And Pilates is called contrology. That's what Pilates is. It's named after the founder, Joseph Pilates. I think started in Germany. It was in Europe. I think it was Germany. And it was the idea, his main concept was contrology, controlling your movement. So how do you control your movement? By building your core muscle. So when you're doing Pilates, you're always trying to control the movement. And some of the movement look like yoga movement, but you go and squat and move one arm and do. But your body need to be ready. Some people go from being sedentary to something like Pilates. And some people even think that going and doing yoga is easy. And it is not easy. Yoga is not easy. I have had people that have back surgery because they had been doing yoga. They don't concentrate on what they are doing. And they have hurt their back and herniated disc. And we have to operate on them.
This is amazing to me. I would think yoga is just lying there and you put one foot up. It's not the same. That's not what it is.
No. Yoga is also, as Pilates, you have different poses that you stretch your body and you work on your breathing. But sometimes people do it and they start joking around and they are not concentrating or they are listening to music while they are doing it. And, anything that you do where you do mind over matter, you're going to do very well.
And that's what yoga is, mind over matter?
Right. Well, Pilates also, you have to concentrate on the movement and the posture of your body and what family of muscle you are exercising with each movement. And the same thing with taekwondo and judo and karate and wrestling. It's all of those exercises. The reason people get hurt is because the instructor fair. And, I'm a grandmaster in taekwondo, so I've been teaching exercises all my life.
Perfect topic for today.
And, when I'm teaching, one of the first things I try to emphasize on is doing meditation. I put all my students to sit down and do 3 to 5 minutes of meditation, relaxation. And meditation is like if you're going to go to bed, you take a shower before you go into bed. You want to go nice and clean, right? So meditation is cleansing your body and mind from everything that has happened before you enter in your training. Even if you're going to train at home, the first thing we should always do is meditation. We relax ourselves, we cleanse ourselves, we forget our problem, we put them outside the room, and then we start exercising. And then the second step is we do breathing exercise. And the breathing exercise, when you take a deep inhalation in through your nose and you let it out between your teeth, and you do that several times, what you are doing now, you are bringing fuel for the muscle. Why? Because you're taking all the CO2 out of your lungs and you are bringing oxygen. So now you have meditated, you prep your mind, you have done your breathing exercise, you prep your lungs. Now you start exercising. When you exercise, you're going to build CO2. And the CO2, when you have CO2, that's what tends to give you pain when it accumulates in the muscle. That's the muscle ache we get. So when we get rid of the CO2, that's called aerobic. If the exercise, you are breathing properly, it could be going for a walk. And even when I go for a walk, I take 3-step inhalation, 3-step exhalation. 3-step inhalation, 3-step exhalation. And then as you do it for hundreds of times, it comes natural. But you see people walking and they don't think about their breathing. They don't think about their posture. They just walk. And that's not quite a healthy exercise.
No, this is amazing. I brag about Dr. Mencia. Of course, that's who you're listening to. For those of you, we just always jump in here. But, I just have to say that Dr. Andy Mencia, he is a master of Taekwondo, but he's a master of a lot of things. He has my admiration in such great ways, and a lot of the people who listen feel the same way. We decide about exercise. I know he's Taekwondo, but I didn't know he knows everything like this. And I sit here mesmerized with the knowledge and the way that you can articulate the things. Now, people listening, I'm sure felt like I do. Yoga, just lie down and you go take a yoga class. Or even people with Pilates, or just plain walking. What you've told us right now, if we did nothing else, I'm sure you have, if people pay attention, they have now learned something that is so important. So now you're telling me when I walk Charlie, I should be breathing as I'm walking and not just kind of pooping along like that, right?
Right.
I never thought about that.
You practice your breathing exercise, and you should be able to work on your postures. Make sure that your core muscle are being worked on, because that's the key. If you're gonna go into yoga or Pilates or Taekwondo or anything else, that you prep your body. So imagine all of those structure exercises that we have out there, swimming, yoga, Pilates, Taekwondo, karate, judo, wrestling, all of those structure, basketball playing, playing golf, all of those structural exercises, right? It's a ladder, it's steps. And you have to first analyze what step are you on now. Are you at the bottom of the stairs, or you are somewhere in the middle? And if you are already on the top, that means you can jump into any exercise and learn it. But if you are at the very bottom, don't jump to the top step, because you're going to end up falling and hurting yourself. You have to go step by step. And it's okay to be motivated to say, I went to the doctor and my blood pressure was high, or I have borderline diabetes, or my cholesterol is high and he or she told me to exercise, so I'm going to go and jump into Pilates. No, you should not do that. You should now go step by step and start doing some exercises on your arm, like walking and doing little by little, doing things. Now, as you go, for example, if you take walking, just go for a stroll. I love walking as an exercise. because it gives me time to meditate and analyze things and think of new businesses and analyze how my business is doing and think of my quote for the day for my staff. So I love walking. Now, when you walk, you should not overdo it. You should start, let's say, a 15-minute walk round trip. Then you add 5 minutes to that. So now you make it 20 minutes, 10. 10 going, 10 coming back to your starting point. And then you go to 25. Then you go to 30. And the distance is not important, but the time at the beginning. Then you can analyze, okay, I'm doing 30-minute walk. How many miles am I doing? So you can get in your car and you go, I'm going from here to there, and I'm doing 4 miles. That's great.
That is really great.
Right. So now, if I walk from this avenue to that avenue, come back, I know I'm doing 4 miles.
Which is 4 miles a day would be, because everyone, they talk about 10,000 steps a day.
Right.
I don't know how many miles that is, but
I don't
10,000 steps. They say if you walk 10,000 steps, that's a very good exercise.
That's a good cardiovascular, right. That's excellent for your body.
But now you said something else, but not just the walking. You said while you're walking, you want to learn how to breathe too.
Absolutely.
Right?
Because you want to make it aerobic, no anaerobic. Anaerobic tend to be painful to the muscle. Those are the people, they exercise, they come, and they say, oh, my body aches so much. That means you were not breathing. So your body should not be aching. If you breathe, if you practice first a little meditation, breathing exercise. After you do your breathing exercise, there's another exercise that is so important, especially in developed country like ours, because our life is too comfortable. We have to do joint lubrication. And you and I did this in one show where we took our ankle and we did the ankle rotation.
Right. And then we
do the knee rotation. Then we do the hip rotation, rotating the hip outward, and then rotating the hip inward, and then making a full circle.
So when I said that I was taking my arms like this, that was all what you're talking about?
That's all, the butterfly with the shoulder and clockwise, counterclockwise. And yesterday I saw one of my patients. She's in her 90s. And she hurt her right shoulder. And she said, just give me another physical therapy. The physical therapy that was coming to me, he was no good. He wasn't doing anything.
Oh, my gosh.
Give me somebody good. So I said, okay, let's try a different company to come and do the therapy. But I told her, this is what I want you to do. Regardless what the therapy wants you to do, this. So I thought I have her lean forward. I'm going to demonstrate for you.
Yeah.
Bring my microphone.
Good.
So I have her lean forward, and I say, just bend at your hip and drop your shoulder down.
I'm standing too. I'm going to do the same thing. So tell me what?
So you lean forward, right?
Okay, wait a second.
And then let's say your right shoulder is the one giving you problem, right?
Okay, yeah.
So you can put your left hand on a chair, or the table or the counter, and drop your shoulder dead. So the whole right arm is dead, dropping dead, like gravity is in control.
Okay.
And then like a pendulum, you do small circle clockwise, and you do that for a few minutes, and then you do counterclockwise.
Wow.
And then you do that for a few minutes. And she did it. She goes, no, this is too easy. I said, no, now do bigger circle. So then she started doing bigger circle. And when you're doing that, if you listen to your shoulder, if you analyze the muscling, it's a lot of muscling that control your shoulder and your hip. When you do the bigger the circle, the more muscle you are recruiting. So when you start with a tiny circle, that's a small amount of muscle in charge, taking control. Then you open the circle a little bit wider. Now you have more muscle. Then you do it a little bit wider. And you will exercise all of the muscle that control your shoulder. And that's so important because when we hurt our shoulders and we don't do that, we develop a frozen shoulder.
A what?
Frozen.
Oh,
shoulder.
Yes, I've heard that.
And when the shoulder freezes, that when you're trying to comb your hair, you cannot reach.
Right.
The arm cannot reach your head anymore.
Yes.
because your shoulder is frozen now. And it's a serious situation where you have to have surgery to operate and restructure that joint so that you can function. You know, it's not an easy life with a frozen shoulder. If you are right hand dominant, imagine you trying to go to the bathroom. Imagine yourself trying to eat with a frozen shoulder. It's really difficult, and that's your dominant hand. So like my patient yesterday, she's right-handed, and she had hurt the right shoulder. And because she's, in her mid-90s, of course it's gonna be the healing process. It's gonna be much more prolonged than a younger person.
Well, wait a minute, I want to go back to what you said though with her. So when she's your patient, you got her a physical therapist. Let's talk about what you do this way with your patients. I mean, we'd love to come to you and have exercise classes, but you don't have time for that.
Well,
so
I usually like to do both. Let's say when my patient have borderline diabetes, I give them my diet. I say, I'm going to give you Mencia's diet, and then I'm going to send you also to the dietitian. But don't forget my diet.
Wait, give us your diet. Wait a minute. Tell me what the Mencia diet is.
Mencia's diet is so simple and so effective that I should publish it.
Right. Well, we will. We'll publish your diet.
If a person have problem with triglyceride, when you get your cholesterol profile, don't let anybody do a total cholesterol on you because it's meaningless, total cholesterol. It can be misleading, a total cholesterol. And the reason it can be misleading because if your good cholesterol is over 100 and your total is over 200 and somebody tell you, oh, your cholesterol is too high, you are 220, it can be a good high because it's based on the good cholesterol. Remember, total means the summation of all the types of cholesterol we have. So when you hear total, ignore that number. That doesn't mean anything. You have to look at your bad cholesterol where you are. You have to look at your triglyceride, and you have to look at your good cholesterol. Now let's talk about the triglyceride. The triglyceride usually will go up because of starches. So if a person is borderline diabetes, they will also have a little elevation on the triglyceride or significant elevation on triglyceride. Now, triglyceride is so impacting that we have drawn blood on patients with high level of triglyceride, and the blood doesn't look red.
Really?
It's milky. Like instead of red blood, it's like milk. So when they draw your blood, if it look milky, you know your triglyceride is going to be super high.
Oh, my goodness.
So here's my diet. Because I say, I believe in respecting people's ethnicity and their way of life. And all we have to do, instead of taking a plane that is going from here to Tallahassee and divert it to New York, is let's go around so that we can still go where our intended destination is. So I follow your culture. I respect your culture. So if you are Korean, you eat your Korean food. If you are Chinese, eat your Chinese. Indian, you eat your Indian food. Haitian, you can eat your Haitian food. But take the starches. And you don't have to stop anything because they say, okay, so I cannot eat spaghetti. I say, no, you're going to eat everything you want to. But we're going to recognize starches first. I want you to recognize starches like you recognize your finger. So rice, pasta, bread, potato. Rice, pasta, bread, potato. Finger, pencil talk. Rice, pasta, bread, potato. You take those four and cut it down by half. Those four sources of starches. Cut it down by half. Now, some people will say, oh, no, I continue to eat a lot of bread because this type of bread is supposed to be healthier than white bread. Healthier doesn't mean a cure for. It's better than the white bread. Yeah, and sometimes with the rice.
Whatever it is, half, right?
Just cut it down by half. If your numbers are high and you are already doing that, you're eating healthier carbohydrate, that means you're eating too much of it. And your body cannot handle it. So all you have to do is just cut down the starches by half.
Okay.
And that will lower your triglyceride. If the sugar is high, like borderline diabetes, then you take the fruits, because that's a source of sweet,
Even though
cut
it's
it down.
natural.
Even though it's natural, it's what your body can handle. Right?
Okay, so you're
So
going to
you
cut
cut down
that
the
down by
sweet,
half.
cut down the
Okay,
fruits by
what
half.
else? What else would it be for sugar?
For sugar, the sweet, everybody know about sweet. You want to cut the sweet by 75%.
Really?
Right, because your body cannot handle it.
75%.
You want to bring your number back to normal. Especially, for the baby boomers, people in their late 40s, early 50s, you get to a point you say, oh, I'm going to get life insurance. They're going to look at your hemoglobin A1C body. They're going to look not only at your sugar, your total sugar, like your general practitioner will look at. And I look on all of my patients. I do the test as if you are applying for life insurance with me.
Wow.
I do all of the tests that we do for life insurance on my patients.
I have to say this. I wish we had another hour with you, but I got to tell everybody your phone numbers. Listen, why don't you go to Dr. Mencia and just do what I do? Sit here and just open my mouth and listen. Sometimes I get to talk, but I love how he talks. So the phone number to make the appointment is 954-489-1345. Remember, Pencil Talk Radio. Write the number down. He is there on Saturdays. He's all dressed up in his suit and his tie. And if you want to just go just to talk to him,
Ready to rock and roll.
go do that. But he's on East Commercial Boulevard, and he is there not all day, so you have to get there early this morning. He's there a little afternoon, but 954-489-1345. They do have a wonderful spa. Is the spa open, Ina, today?
Yeah, spa open every day, 7 days a week.
Really? The
Yes.
spa is called Stonewater Med Spa, and Dr. Mencia is the medical director, and it's over there on East Oakland Park Boulevard. Well, there now you can go get your facial, get your nails done, get everything is a wonderful.
Your salt treatment.
Yeah, see, that's the
No,
one I
remember
haven't
it's a
done.
summertime. You gotta do your body treatments, body exfoliation.
Oh, right.
Because a lot of us will
And
go
what
in
is
the
that?
sun.
The Viking, the one that you did, that you lay down on the
Yes, Vichy shower.
the Vichy shower.
That's where you do body exfoliation.
so
I
I-
love that one so
I
much. I
have
have
to-
not done that.
Oh, I want to do this. I want to make an
When you
appointment
gonna
with you.
come? Do
I
the
wanna
beachy
do
shower.
That. I want to do
Yeah.
that with you. Can I come when you're there?
Of
I'll make
course.
a date with you, and we'll go.
Yeah.
I want to do that.
A
So it's
girl's
very
day
imp-
out.
Yes,
Girls' day out.
Yes, it's very important to do during summertime.
Rachel and I,
especially
we're
when
gonna
you
put
live
on a
in
wig
South
and we're gonna
Florida,
fake
when
it.
you're always exposed to the sun, you have a lot of dead skin on your
That's
body.
true.
Oh.
And you exfoliate your body, and then you do blood sea mud treatment or seaweed treatment, and you detoxify your body.
Okay, I'm going to do this with you.
Gonna
You and
do
I
it.
have to do this.
I'm gonna have seaweed growing out of my armpit.
No, wait.
No, we don't want to go there.
No, wait. I just had to tell everybody about that, but I want to go back to you. So the Mencia diet, I heard about the sugar, heard about the starches. What else?
The fruits.
The
Cut
sugar.
down the
right.
fruits
the
by
fruit,
half.
okay, by
And
half.
that's it.
The
That's
starch.
it. No
Is that
counting
right?
calories.
That's it?
That's it. You do that basic thing because that's our source of food.
Do you eat meat? I love
Of course,
meat.
yeah.
You eat meat.
I
Besides
like
fish,
I like salmon because it increases
Yeah.
your good cholesterol.
Right.
Sardine, fish. I love fish in general.
I like
White
beef.
meat.
I do like beef.
But
I have to
and I
tell
get
you.
my steak from time to time, but you have to earn it.
Yeah.
That's
You
all.
have
You
to
know,
earn
you
it.
have to earn your steak.
Earn
They have to be good.
You have to
Yeah.
earn your steak. Well, we
And
have
then
2
I grab
minutes.
my steak and I cut the fat out. I cook with the fat and everything. Some people take it before they cook.
Oh, and then you
No,
get
you
rid
can
of it
cook it
before
with
you
the
eat
fat.
it.
Yeah, just cook with the fat. It give you that taste, And
Let's have a spa at his house. We could do exercise. We could do food. He would do everything. How about a long weekend at your house? How many people can you sleep there?
ooh, one.
No, why don't we have like a little spa weekend?
Yeah.
You could go, I could go, we could have, and you could feed us, and we could do exercise. Think about that.
Okay, when I do all my construction, we're gonna have a party.
No, and it's not a party. It's a spa weekend.
Spa weekend.
It's a
We'll bring
relaxation
our-
weekend.
Yeah,
Okay.
we'll bring our own.
I can see Ina by the bar with the relaxation.
With the bottle of vodka.
With the vodka.
Let me
Put it on-
relax.
Put it on my rocking chair. Lean
There you
forward,
go.
serve my glass. Lean back,
No,
drink.
listen, I am serious about this. Why don't we have a Mencia weekend? It's like a retreat. and we could come and we could eat the right thing. You can teach us, have your nutritionist there, and we'll pay. I mean, I think I've just developed something for you. I mean, I don't know if you want to take the time, but we could all come. Like Friday night, we'll bring our own little roll beds, and Friday night, Saturday night, and Sunday.
Sleepover.
A sleepover.
Yeah.
I mean, is that not allowed? Is there something bad about that?
No, it sounds good
and we
to me.
could find men and women. I mean, maybe have 6 people.
It's a party!
Okay, we're out of time. Anyway, this was fun. Thank you. On this note,
I'm out.
Think about it. Okay, that's it. All right, everybody. I hope you enjoyed as much as I did. We never have enough time with Dr. Mencia. Thank you, Dr. Mencia and
Thank
Ina.
you, Anita.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.